Hello, everyone. Thank you for joining us. Our webinar will begin shortly. While you're waiting, please take a moment and answer the questions that you see on your screen. Number 1, pediatric vehicular heat stroke deaths have occurred in U.S. northern states and during winter months. True or false? Number 2, what is the lowest outside air temperature needed for a vehicle's inside temperature to reach lethal levels? Less than 70 degrees, at least 80, at least 90, or at least 100 degrees? Number 3, outside of what location do the majority of pediatric vehicular heat stroke deaths occur? A, child care facility, B, home, C, mall or casino, or D, work? We'll get started in just a few minutes. Hi, everyone, and thanks for joining us. Our webinar will begin in a few minutes. Please take a moment to answer the questions that you see on your screen. Our first question, pediatric vehicular heat stroke deaths have occurred in U.S. northern states and during winter months. So far, all of our respondents have checked true. Our second question, what is the lowest outside air temperature needed for a vehicle's inside temperature to reach lethal levels? 79% of you said less than 70 degrees. Almost 20% of you said at least 80 degrees. 5% of you said at least 90 degrees. And no one has yet chosen at least 100 degrees. Number 3, outside of what location do the majority of pediatric vehicular heat stroke deaths occur? Child care preschool facility, home, several of you chose that option. Mall or casino, also several of you chose that option. And more than half of you chose work. Okay, thanks very much for taking that time to answer our poll questions. Good afternoon and good morning to the folks that are joining us from the West Coast. It is a pleasure to welcome you to our webinar on protecting children from heat stroke in vehicles. This webinar is sponsored by the Children's Safety Network. My name is Kristin Kingsley. I am an automotive safety engineer, and we are here to talk about the devastating issue of children dying in hot cars. How does this happen, and how can we reduce the risk? This project is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. This information or content that you hear today and conclusions are those of our speakers and should not be construed as the official position or policy of, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government. Before we get started, before I introduce our speakers, let me turn it over to Kate to talk about the technical details.
All right, great. Thank you, Kristin. So first off, if you can hear us right now, you'll notice that the audio is being broadcast through your computer speakers. The quality of your audio is going to depend on your bandwidth. If you're experiencing audio issues, you can dial 866-835-7973 and please mute your computer speakers. You'll be muted during the webinar. We ask that you put any questions that come up during the webinar in the Q&A pod to the left of our slide. This session is being recorded, and a link to the recording will be sent out to all of our registrants within a week. And above our slides today, you'll be able to see a download pod where you can download today's slides. Back to you, Kristin.
Thank you so much, Kate. Now I'd like to introduce our speakers. Amy Artuso has worked in the area of children's health and wellness for 25 years. In her role with the National Safety Council, Amy serves as a subject matter expert and manages federally funded programs supporting the safety of children in and around vehicles. Prior to joining NSC, Amy worked in pediatric injury prevention at Johns Hopkins. Amy has a master's degree in public health and is currently earning a Doctor of Public Health degree in advanced practice leadership. She is a nationally certified child passenger safety technician instructor and is a past chairperson of the National Child Passenger Safety Board. Welcome, Amy. Our other speaker, Jan Null, has been a meteorologist in the San Francisco Bay Area for over 46 years and is an internationally recognized expert in the topic of heat stroke deaths of children in vehicles. After the death of a child left in a vehicle in San Jose in 2001, Jan did a comprehensive study of vehicle temperatures that was published in Pediatrics in 2005. Since that time, he has tracked cases and continued his research. He founded noheatstroke.org, a comprehensive website with pediatric vehicular heat stroke death data by state, by month, summaries of laws regarding unattended children in vehicles, as well as prevention recommendations. Jan has spoken at numerous national conferences and worked with a wide variety of child safety advocacy groups and agencies to raise awareness about the dozens of children who die from heat stroke in hot vehicles each year. Welcome to both of our speakers. I'll turn it over to Jan. Thanks, Jan. Welcome.
Thank you very much. It's a pleasure to be here, and thanks for inviting me. I'm going to be talking about a lot of data and numbers over the next few minutes. And almost all of this information, number one, you'll be able to download the slides, but it's available at noheatstroke.org. And I always welcome any feedback along the way and after the fact as well. These are some recent headlines from, fortunately not this year yet, but from the last 2 years. And each one of these, as Kristin said, is just an utter tragedy. I'm going to be talking about some of the stats and the statistics related to heat stroke. And that's primarily so that advocates and other users have information that they can use to help prevent some of these. I'll talk about what heat stroke is, how cars heat up, how I go about tracking cases, some of the states and some of the laws that are out there, the trends and patterns in the data, some of the current technology out there, and then wrapping up with some safety recommendations. So I'm sure a few of you have already scratched your head, well, what's a meteorologist doing in this realm? Well, as Kristin said, I've been a meteorologist for 46 years. I got a question back in 2001 after a 5-month-old died in San Jose from the local media who I dealt with in weather-related questions. And he asked me, Jan, how hot could have gotten in that car? I said, I don't know, but I could find the answer. Somebody's done a study. Well, there really wasn't anything very comprehensive. I did my own controlled study the following year, ended up working with a couple ER doctors from Stanford, and in 2005, this was published in Pediatrics, and it's now is one of the go-to studies on the topic. I love this slide right now. We have not had a pediatric vehicular heat stroke or PVH death this year. Would love that this is the slide that I can show at the end of the year as well. Last year, there were 24 deaths across the country, which is quite a bit less than the average, which is 38, and much less than what we had in both 2018, and then this slide is from 2019 when there were 53. Going back to 1998, there have been 882 documented deaths, and we are sure that there are deaths that have gone under the radar and not documented. I'll give you some direction on how to maybe find out what we already have in the database, and possibly you can help out with filling in that data, some of the cases. You can certainly see here at the end of the graph the drop-off from 53 down to 24. Our hypothesis, this is pandemic related. People are staying at home, not going out, not forgetting children in cars. The issue of children dying from heat stroke in cars is not a new one. I mean, it's been going on as long as there have been, children in cars, but it really got ramped up in the mid-1990s. And this is one of those cases of unexpected consequences. We started putting airbags in cars in the late 1980s. We discovered shortly after that infants and children in the front passenger seat were being injured and killed as those airbags deployed. So it was mandated that children be moved out of the front passenger seat into the back seat. That was at about the same time that the child safety industry developed the rear-facing child seat, saying that those were safer for children. So now our children are in the back seat, and they are basically out of sight and unfortunately sometimes out of mind. This is the geographic distribution of PVH deaths going back to 1998, and you can see certainly the concentration across the southern states, Texas and Florida, sadly way out in front. But there are only 3 states that have not had a PVH death, New Hampshire, Vermont, and Alaska. Probably a more relevant statistic is looking at this on a per capita basis. And so, again, it shows the cluster of those states that are in that darkest color there, down along the Gulf Coast and up in and around Texas. Texas moves out of that highest category just because of their large population. Children are left in cars or gain access to cars in 3 broad categories that we look at as far as these deaths go. Just over half the cases are where children are accidentally forgotten in a vehicle by a parent or other caregiver. And of that, 46% of that fraction are where they were supposed to have been dropped off going to preschool or daycare. The next category is the gained access, just more than 25%. And those are when typically a little bit older child, toddler, 2.5 years to 5 years typically, have gained access to a car on their own and become overcome by the heat. And then the almost 20% are where they are knowingly left in a vehicle by a parent or caregiver while they have something more important to do. Go to an appointment, go to the go into a store, go to the racetrack, go to the casino, go to a bar. Lots of all bad reasons. Here's that same graph going back to 1998 with the mean line shown, and also the a 5-year running mean. And so we can see, with the exception of last year's drop off again due to COVID, that trend line has not been going, or the running average has not been going in the direction that we have wanted it to. And that's primarily driven by the forgotten category. You look at the trend line here versus the knowingly left category. It had been going up and then fortunately had flattened out a bit. And the one category where there's been some improvement has been in the gained access category, where again, where children get into a vehicle on their own. And we'll talk about later some of the ways to prevent all of these. The breakdown of the most responsible person is almost 40% is the mother, and about 25% is the father. In the category of typically in gained access, and both parents are considered the responsible person, and then you can see with the breakdown of the other categories where children might be left. But it can happen to anybody. This is just a quick list that I put together of some of the categories of the children or the people who have been responsible for leaving a child in a car or letting them gain access. And it covers the whole socioeconomic gamut. A little more than half of the kids that die in hot cars are under 2 years old, and then you can see the decreasing numbers as they get older in age. They can oftentimes get out of the vehicle or call attention to themselves, with the overall average age, though, being at 26 months. when I developed this data, I found it very interesting that that it doesn't happen the same every day of the week. And we see here that Thursday and Friday are when the most number of PVH deaths occur. And the sort of our working hypothesis is that parents and caregivers are more distracted, they're tired, lots more things have fallen on their plate during the course of the week, and this would be would possibly be the cause here. And breaking that down, and we see this especially in the forgotten category, it really ramps up on Thursday and Friday. The gained access category, as you might expect, or the highest numbers are in the weekends when children are at home and have unfortunately the access to get into unlocked vehicles. And the knowingly left category, pretty much even across the week. The primary location, a little more than half the cases, is where a child has died in a car at the home. Now, this combines both forgotten and the gained access category. But 50% are at home. Another almost one quarter of the cases are at work, and then a breakdown at other places left in parking lots, on the street, in a car at the park, at the mall, various places like that. The temperatures that these occur, and we'll see when I talk about the heating of cars in a moment, it does not have to be an uber hot day for these to occur. Yes, over half occur with temperatures over 90 degrees, but there have been a significant number of these cases where it's been under 70 degrees when the death has occurred. There's a case that I'm well aware of here in the San Francisco Bay Area where a child was left at the BART, or Rapid Transit, parking lot all day, and that was a 67-degree day, and it resulted in a fatality. So this is an obvious slide with the highest numbers occurring in the summer months, but there has not been a month when there has not been a PVH death. And here's a breakdown. This is one of the tables that's on noheatstroke.org, and again, you can see the concentration in the summer months. We get about 80% of the cases happen between Memorial Day and Labor Day in that little over 3-month period. The average date of the first fatality is March 22nd. We've gone as late as May 13th, and would love to see that go way past it this year. So what is heat stroke? It's under the broad category of hyperthermia, elevated body temperature. The clinical definition of heat stroke is when temperatures, the body temperature reaches greater than or equal to 104 degrees. That's the body's cooling system gets overwhelmed. You can see some of the symptoms that will occur. One of the important ones for first responders is the flush, dry skin. People will stop perspiring when they are in heat stroke. And children's bodies are less capable of cooling themselves. They have a lot less surface area for their mass. Their bodies heat up 3 to 5 times faster than adults. So you or I could be in a car with a high temperature for an extended period, but an infant or a child might not be survivable in that sort of situation. When the body temperature is over 107, cells inside the body get damaged, organs shut down, and deaths can occur. So, as I mentioned at the top, I did a controlled study in 2002 using a remote thermometer. I looked at 16 different days, outside temperatures ranging from 72 to 96 degrees, from 0 to 60 minutes. A couple of those days I cracked the windows 1.5 inches in all 4 vehicles. A car heats up the same as a greenhouse does. The sun's shortwave energy, very intense. It heats up objects inside the greenhouse or inside the car. That in turn gives off long wave, energy, which is very efficient then at heating the air inside the car. And because both are enclosed bodies, that temperature will heat up. And again, the air in the windows are relatively transparent to the sunlight, but again, the objects that light strikes will warm up the air. In doing some of my studies, I've often used an infrared thermometer looking at the temperatures of various surfaces, and this was on a warm California day. It was 95 this day, but you can see some of the temperatures. The 179 was up at was the dashboard, and I've seen dashboards get up to 200 degrees. This is the raw data from the study, and the really startling thing for me when I did this back in 2002 is that the lines are all relatively parallel to one another, so that the gain in the first 10 minutes or so is about the same gain whether you're starting in the 70s or if you're starting in the 90s. And it allowed to make a very straightforward relationship where we see the big gain in the first 10 minutes of 19 degrees, adding another 10 degrees in the next 10 minutes, and after about 40 or 50 minutes, the amount of total rise has flattened out from to 43 degrees after 1 hour. Just a quick walkthrough. This is would be an 80-degree day, a relatively mild day, as we are looking around the country in the spring and summer and early fall. After 20 minutes, it's at 109. And by an hour, 123 degrees. Not a survivable temperature for an infant child. If it's a 90-degree day, that would be 133. 100-degree day, it'd be 143. This is a breakdown of that same data. The information in the black was from my published study, and then the blue is in is just the extrapolated data, the sorts of temperatures that we might see going on out through 1 hour with temperatures over 95. And I've actually have recently done some testing looking at greater than an hour, up to 4 hours, and we see rises over the outside air temperature of in excess of 50 degrees. So to kind of wrap up the heating part, most of that temperature gain is in the first 30 minutes. 80% of that, it plateaus at that 45 or 50 degrees. The cracking of the windows had minimal effect. There's cooling of possibly 2 to 3 degrees in the cases I looked at. When we're looking at temperatures in the 120s, that doesn't make it any more survivable for sure. It doesn't have to be a really hot day. And one of the interesting things I found was that dark cars are not necessarily worse than white cars. It's the color of the car's interior that matters. And it is typically darker cars have darker interiors. So the way that I track cases is through electronic media reports, using up to 20 different Google News searches. Also, I have contact with media and authorities. They will let me know if they find a case. Using death certificates and ICD codes, we're getting less than 50% of the numbers of cases that we do with the media reports. So at noheatstroke.org, there's an area for information by state, and then there is a complete breakdown, every case that we have documented going back to 1998, sorted by state and sorted chronologically. And again, if you know of a case that's not there and can let me know, I'd very much appreciate that. There are only 21 states that have laws that prevent leaving an unattended child in a vehicle, and even a number of those have time limits on them. Florida, you can leave a child for 15 minutes before it becomes a crime. 5 minutes in Texas, and in Rhode Island, you can only get a verbal warning. There is no written record of leaving a child unattended in a car. And parenthetically, there are 30 states that have laws against leaving pets in cars. We're seeing an increasing number of states that have Good Samaritan laws, where if a person sees a child unattended in a vehicle who looks in distress, the child is able to be removed without civil or criminal penalties in most of those states. There's been some work done by Dr. Monica McCoy at Converse College, where she's looked at the number of prosecutions that there have been. Typically, mothers are sentenced more harshly than fathers. Paid caregivers are charged even more harshly. 84% of those are charged, and 96 are sentenced. The unintentional category is less than the intentional category. So in the knowingly left category, the possibility of prison sentences is much higher. If there are alcohol or drugs involved, the percentages are significantly higher with that as well of being sentenced, and the terms are longer. The numbers of mothers who are involved, almost half of those end up with no prison time. Fathers right at half, and paid providers within higher percentages are in the they do get prison time or jail time. There's lots of technology out there. I'm approached by inventors on a very regular basis. But if you look in the shelves at Target or Walmart or online at Amazon, you won't find very many devices out there. And I think it goes to the mindset of most parents that I would never forget my child. There is a voluntary plan by auto manufacturers have reminder systems in all vehicles by 2025. That's almost all the manufacturers. But those primarily address the forgotten category. There is now some technology that is starting to look at if a child gains access. But if we end up doing the math, that's not going to be the answer. It's not the panacea. And so technology can only be a single layer of the many layers of protection that we need to have for our children. Never leave a child in a car even for a minute. I see cases on a weekly basis where a child is in a car while mom or dad runs back in the car to gets back in the house to get something, and the vehicle is stolen or outside a 7-Eleven or a gas station. If you see a child unattended in a hot vehicle, call 911. If a child is missing, check the pool first, and then all surrounding vehicles, including their trunks. That's where harm can come to them in the least amount of time. Have a routine to look before you lock. Make sure everyone's out of the car. Keep a reminder in the car seat. If put that reminder up in the front with you as a visual reminder when you get out of the car. Teach your children never to play in vehicles. Keep those remote fobs out of their hands. And if they are trapped, teach them that they can possibly go out the front driver's doors, or they can teach them to honk the horn and gain attention. And have a plan with a child care provider. If the child doesn't show up, have them contact you. A lot of these cases, that almost 25% of all cases, if plans like this were in place, there would not be the tragedies that we have seen. This, I think, is one of the most poignant slides or pictures I've ever seen. I think it tells the story all in one picture. So thank you very much for your time and attention. Feel free to contact me through the website, through the phone, or my email is there. So again, it's been a pleasure. Thank you for inviting me today.
Thank you so much, Jan, for your presentation, and thank you for your years of dedicated service in collecting data about these incidents and compiling statistics and helping us all get a better understanding of how this can happen. To our audience, please put any questions that you have in the Q&A box. We are going to hold them until after our next presentation, but do not wait to put them in there. Without further ado, let me introduce our next speaker, Amy Artuso from the National Safety Council. Amy?
Thank you, Kristin. Hello, everyone. I'm Amy Artuso, as I'm with the National Safety Council, or NSC, and I'd like to thank all of you for taking the time to join us today, as well as thank Children's Safety Network for hosting the webinar on this important topic. Pediatric vehicular heat stroke is the leading non-crash motor vehicle-related cause of death among children in the U.S. So while the injury and fatality rates are not as high as some other injury prevention statistics, as a parent, an aunt, a neighbor, as well as a variety of other roles I hold myself, I'm of the firm belief that one child's death is too many from this preventable cause of death. In partnership with Jan Null, who you just heard from, a few years ago, NSC released a report summarizing the issue of pediatric vehicular heat stroke and unattended child loss throughout the U.S. This report includes information about vehicle heating dynamics, the 3 primary circumstances leading to this preventable cause of death, as well as a quick reference chart where you can see if your state has an unattended child law or a Good Samaritan law that specifically addresses unattended children in vehicles. You can also review the components included in each law because they do vary quite a bit from state to state. This report provides recommendations and a call to action for lawmakers, parents and caregivers, and the general public. Throughout this webinar, Jan and I are both sharing website information where you can find a free copy of this report, and I hope that you'll take the time to check it out. As a next step following that report, NSC released a free online training to educate the general public about children in hot cars. This training takes about 10 to 15 minutes to complete and offers a certificate of completion at the end. And I'm proud to share that the development of this training was funded by the employees of the National Safety Council through their dedication to eliminating preventable deaths. It is also available in Spanish. Both versions of the training can be found at nsc.org/hotcars, along with other free downloadable resources that I'll talk more about in just a little bit. The training reviews why cars heat up, how children die in hot cars, and what you can do to prevent further deaths. There are also additional resources that you can download and share that are found within the training. Again, this training and related materials are all found at nsc.org/hotcars. I encourage parents to complete this training and any others that transport children, including grandparents, babysitters, and child care providers. This information is even important for individuals that may not have children of their own, but live in neighborhoods with children or work with colleagues who have young children. And if you think back to the polling questions when you entered the webinar today, you were asked about where and when heat stroke deaths have occurred. As Jan shared, children have died in all but 3 states, 3 U.S. states. And so this is not only an issue that pertains to warm weather states, and deaths have occurred in every month of the year. While deaths are more frequent in the summer, because of vehicle heating dynamics, this is an issue that we need to be mindful of throughout the entire year. And because it's such an important part of this issue, I want to reiterate that pediatric vehicular heat stroke can happen to anyone. It is really difficult for caring and loving parents and caregivers to fathom, but this tragic scenario can and has occurred to individuals from a variety of backgrounds. As Jan mentioned, it's happened to a physician, police officer, clergy, postal worker, a rocket scientist, and many others. The NSC Hot Cars training includes a video sharing one father's experience about how this happened with him and his family. He shares that he thought this only happened to bad parents until it happened to him. I hope you'll take the time to visit this training and watch the video that's included with this father. So I encourage you to take the training, review the resources, and utilize these materials in your community and other education efforts. As just a couple of examples, this training has been shared through the American Association of Family and Consumer Sciences for use with high school programs, and some hospitals have used it to facilitate community education classes. If you'd like to talk through how you can incorporate this training in your program, please feel free to reach out to me. I'd be happy to talk with you. And again, please keep in mind that this resource is available at no cost. Both the English and Spanish trainings have supporting resources that accompany them. You can use these resources to help share information about this risk, why children are more vulnerable, and encourage others to learn more. These resources include a poster, a RAC card, and a communication aid. You can see the English and Spanish communication aids here on this slide. This aid provides examples for communication on social media, via email, as conversation starters. It includes the vehicle heating chart that Jan just went over with the supporting data, and website addresses for more information. Next, you can see a cut and share flyer. This is another free downloadable resource on nsc.org/hotcars. It is one standard size piece of paper that you can print and is available in English and Spanish. This resource allows you to create 2 handouts from a single piece of paper. It helps you let others know about the available free Hot Cars online training, website addresses for more information, including Jan's website, noheatstroke.org, as well as a summary of how quickly the inside of a vehicle heats up. On this slide, you see a look before you lock checklist. Share this information with others and encourage them to create a consistent routine so it becomes a habit to always check the back seat of their vehicle before locking and walking away. This look before you lock message addresses 2 of the 3 primary circumstances that lead to pediatric vehicular heat stroke deaths. First, make sure you're not unknowingly leaving or forgetting a child in a vehicle, and then always lock your vehicle so children cannot gain access when the vehicle is unattended. In addition to creating a routine, the checklist reminds us to put something you need once you arrive at your destination in the back seat, so it serves as an additional layer of protection, requiring you to go into the back seat before leaving your vehicle. I like to suggest securing your cell phone in the back seat, as this will also help minimize distracted driving and the temptation to check your phone while driving. And I'd like to point out that I'm specifically suggesting you secure whichever item you place in the back seat, as this is another injury prevention measure. While I hope you won't find yourself in a motor vehicle crash, in the event of a crash, loose items become projectiles and are another risk or source of possible injury. So you can see these easy tactics can serve to protect you and other occupants in your vehicle in a variety of ways. Some additional suggestions on the checklist include asking your babysitter or child care provider to call you if your child doesn't arrive as expected. You can set an alarm on your phone or computer calendar as a reminder to drop your child off at child care. We suggest making this alert a different sound than other notifications so it stands out for this particular purpose. And if you have a change in your routine, such as a different parent is taking your child to child care than usual, make sure you and the other person communicate around the time drop-off was supposed to happen. For example, if I typically take my child to daycare, but today my husband is taking him, I would set an alarm on my phone to call my husband around the time he's supposed to be dropping off our son to check in and confirm all went as planned. This isn't meant to imply that I don't trust my husband, but rather it adds a layer of protection in our busy schedules, especially since on this particular day, again, just as an example, we're operating outside of our normal routines. We want to make sure we don't just go do our regular activities or go about our regular schedule on autopilot, especially if baby falls asleep in the back seat and is out of direct sight and is quiet. Another low-cost option is to keep a stuffed animal in the child's car seat. You can place the stuffed animal in the front seat when your child is in their car seat. This serves as a front seat reminder that your child is with you, again, especially in case they fall asleep and are quiet or you become distracted. And consider technology that alerts drivers to check the back seat of a vehicle. Both car seat and vehicle manufacturers have made available various alert systems to help remind drivers to check the back seat, and this technology continues to evolve. I do encourage people to educate themselves about the differences between alert and detection systems, as one serves as an audible or sound reminder, and the other can actually detect the presence of someone in the back seat. These are different, and it's important for this difference to be understood, especially by those using this technology. I'm also excited to let you know that coming soon, the Our Driving Concern program, a program managed by NSC and funded by the Texas Department of Transportation, will be sharing new employer resources as another channel for education. These new resources will also complement the NSE Hot Cars online training and include a safety talk, videos, safety coach cards, and more. I really like the safety coach cards as they are a set of questions and answers that you can use to open up staff meetings with a quick educational learning moment and support interactive conversation among your work team. So I definitely encourage you to check those out once they become available, which should be very soon. Here you can see a do-it-yourself pocket zine. I love this. It's a standard-sized piece of paper that you can print and fold so it becomes like a little magazine that fits in the driver's pocket. This resource can be helpful for anyone, but it's intended for use as a safety guide for employers and employees, highlighting cars at the workplace. According to noheatstroke.org, almost a quarter of all children who have died in hot cars since 1998 occurred in a parked vehicle at the caregiver's place of work. This pocket zine, or mini zine, includes information about how children die in hot cars, or the three primary circumstances. As a reminder, these are children being forgotten or unknowingly left in a vehicle, gaining access to an unlocked vehicle, and when children are knowingly left in a vehicle, for example, while a parent runs what they think will be a quick errand. The pocket zine also addresses the myth that pediatric vehicular heat stroke would never happen to me. It includes the vehicle heating chart and encourages people to be attentive pedestrians. Don't be a distracted walker, but rather be mindful and aware as you walk through parking lots. And last but not least, the pocket zine provides guidance on what to do if you see an unattended child or animal trapped in a car. In case you aren't already aware, you should immediately call 911. If others are available nearby, you can ask someone else to search for the driver or ask the facility to page the driver using the vehicle license plate number. Don't wait more than a few minutes for the driver to return. If the child's not responsive or appears to be in distress, immediately take action to remove the child from the vehicle, and then stay with the child until help arrives. These tips are all summarized on the pocket zine. In addition to finding the resources I've discussed on nsc.org/hotcars, these new materials will be available on cpsboard.org/heatstroke, the website of the National Child Passenger Safety Board, also a program managed by NSC. This page is the result of a collaborative advocacy effort led by the National Highway Traffic Safety Administration, or NHTSA, that provides links to resources from a variety of advocacy organizations. These organizations include NSC and NHTSA, noheatstroke.org, as well as Safe Kids Worldwide, the American Academy of Pediatrics, the CDC, kidsincars.org, and articles by Dr. David Diamond, who is with the University of South Florida. These articles address the question of how can a child be forgotten. This page is in the process of being updated in preparation for National Heatstroke Prevention Day, which takes place on May 1st. In the meantime, you can find resources that include monthly newsletters that were created last year with information from Safe Kids Worldwide, noheatstroke.org, kidsincars.org, and NSC, as well as the NHTSA virtual press event held last July. NHTSA just released information about their live virtual press events scheduled for April 29th this year, which will kick off NHTSA's national Where's Baby? Look Before You Lock 2021 media campaign and prepare for National Heatstroke Prevention Day on May 1st. If you want to mark your calendars, these virtual press events will be held at 10:30 and 1 p.m. Eastern Time. I encourage you to visit cpsboard.org/heatstroke to learn more and consider how you can participate and plan for National Heatstroke Prevention Day on May 1st this year, as well as ongoing education and advocacy efforts to prevent further deaths in hot cars. Please share this information with others you think might also be interested in these upcoming events. All are welcome. Excuse me. In addition, the National Safety Council includes Pediatric Vehicular Heatstroke and materials to support Distracted Driving Awareness Month, or DDAM, which is observed during the month of April. A link to those materials can be found in the blue National Safety Council tab on cpsboard.org/heatstroke that you see here on this slide. And I'd also like to add that I've been asked if vehicular heat stroke is considered part of child passenger safety or occupant protection. My answer is that over the last 20 years, approximately 3/4 of all child deaths from vehicular heat stroke have occurred at what turned out to be the end of the child's transportation journey, and 100% have died in the enclosed space of the vehicle. So I do encourage you to take the information and resources you're learning about today and incorporate them into your child passenger safety or car seat safety efforts, as well as other community education and advocacy programming. One last note, NSC will soon be hosting a new academic work group to focus on next steps in pediatric vehicular heat stroke prevention. If you or someone you know would like to participate, please email me at amy.artuso@nsc.org. I'd also like to say a special thank you to curriculum designer Rebecca Adler, who has helped NSC with the creation of all of these resources, from the report to the online training to all the additional resources that I have gone over with you today. So again, I encourage you to visit nsc.org/hotcars and cpsboard.org/heatstroke for resources and information. Thank you very much, and with that, I'm going to turn it back over to Kristin.
Amy, thank you so much for your presentation, and thank you for all the work that you're doing and all of these very valuable resources that you've shared with all of us in hopes that we continue to spread the word more broadly. We have a lot of good questions coming in. A reminder to our audience to please go ahead and submit your questions via the Q&A box. Amy, one of the things I've seen a couple of iterations of is the idea that folks just don't think that this could ever happen to them. And I've been working auto safety for 20 years. We have an audience full of public health professionals, and I would bet that even a few of us on this webinar today, before watching the last 45 minutes worth of presentation, also thought this couldn't happen to me. I'm sure that hopefully most of those minds have changed, and some people are going to check out the training on the National Safety Council's website, but not everybody has the opportunity to sit in on a webinar like this. How can we reach all of those parents who just see these news stories and think that could never happen to me? How can we reach them?
Well, I think you have to assess the makeup of your programs and what communication channels you do have available to you. And then if there's any of the resources that we've gone over today that you think you could utilize, you are welcome to link directly to these. They're all available online. You can use those hyperlinks, include them in your electronic communications. If you're able to print and share, like the cut and share folder with parents in different settings. Again, these are all free, downloadable, and available for you to share. And if anybody wants to talk with me about their particular programs and strategize together or try and be creative, I'm happy to talk through that with anyone.
Yes, thank you, Amy. That's great. Yes, I encourage anyone who has a broad network to please reach out to Amy and take advantage of these resources. They are fantastic, especially concrete steps that folks can take to make sure that they don't forget. Jan, question for you. You have many years worth of data, and it is amazing what you've been able to do with it to try to get at what are the factors surrounding these deaths. Is there any information available about survivors of pediatric vehicular heat stroke who have suffered, long-lasting effects but have not died?
There really isn't. We are able to, even tracking the numbers of deaths, as I mentioned earlier, we're not getting all of those. And sadly, the cases where children are injured and sometimes have debilitating injuries that are lifelong from being in a hot car are not deemed to be newsworthy, and so they're not getting tracked, but they happen all the time in way too many instances.
And is that something that that the NHTSA not in traffic database might have, or are those limited to fatalities? And I know you said that doesn't get all of the instances as well.
I don't have an answer of all the the keys that are in the NHTSA database. They have their a lot of statistics based on all sorts of vehicular accidents, and I don't know if that's one they are tracking.
Okay, great, thank you. I was just wondering that another question came in. If you know, why isn't the death certificate reporting more accurate? Why is there a difference between what you're seeing in news reports and what's in the official databases?
What I'm told by people in the healthcare data side of all this is that what are called ICD codes, the way that deaths are coded, if it is not listed as in a vehicle, environmental heat, and a child is not going to get picked up in those reporting systems.
I guess, Amy, another question for you. How can you share more information with maybe pediatricians' offices or things like that, where this can be something that every new parent learns about?
So the American Academy of Pediatrics does have information on this topic. They have a Healthy Children website. If you go to the website we shared, cpsboard.org/heatstroke, there is a tab specifically for the American Academy of Pediatrics, and you can visit their resources there. Aside from that, I would encourage you as advocates to take some of the resources we've gone over today, and talk locally to your pediatricians. Discuss with them or their office staff that you think this is an important topic. Just raising awareness that these free resources are out there. Maybe check out what the laws are in your state, the number, some of the data that's relevant to your state, how many deaths have occurred. And, Jan has a great trends and patterns resource that can be printed out on noheatstroke.org. Make the data relevant to you locally, be an advocate, have conversations, and then encourage others to also share the information.
If I can add, in Texas they have a great program where it's mandated that materials be given out when new parents are discharged from the hospitals with their babies, information about children dying in hot cars. So I'd love to see that in every hospital around the country. But as far as you know, Texas is the only one right now.
Good. It sounds like there are some states doing some things. There are some that still need to catch up. And we have another question related to that. And either Jan or Amy, if you want to try to respond. Why don't more states have laws? Is there active resistance or apathy, or is it something else?
I certainly don't know. The only thing harder to forecast than the weather for me is politics.
I would add, I don't think there's I don't think there's a consistent answer. I think it depends on the culture of the individual states. And I can, from experience that I've had in trying to advocate for legislation, I think often, and keep in mind this is not a reflection on any institution in particular or their position, but I think it usually comes down to belief systems that there should be a separation from legislation and allowing people to make decisions for themselves. And so on this topic, I think there is definite room for improvement in understanding vehicle heating dynamics in particular. If we can shift the focus away from, I would never forget my child, to understanding how quickly vehicles heat up and the mechanics of that, I think we might do better in that area.
So it sounds like really it's going to have to be a combination of laws and enforcement, but also education and awareness, as well as what technology does exist and is effective. Is there anything that you can say that is missing from this conversation that would help make a bigger difference?
Go ahead, Jen. So I'm also a public health person, and I think for anybody that's familiar with behavior change and the health belief model, I would love to see more focus groups or key interviews to drill down into, you know, what are perceived barriers, what are perceived risks, you know, get to the root. And I think anyone in public health would probably agree. You have to, it's not going to be a cookie cutter answer. You're going to segment to your audiences, and we have to get a better understanding of the belief systems by parents and caregivers when it comes to this topic. We know already just from watching social media that it's a barrier. People don't think this is a relevant topic to them because they don't think it's going to apply to them. And if we can have more effort in this area of engagement, you know, the educational materials out there, but you can't make people engage with it if they don't think it's relevant to them or if it's not worth their time. You know, costs are not only financial, it's time, you know, and everybody's really busy. We've had definitely a unique situation the last 12 months in particular, and I think it's the benefit has to be considered of greater value to people than the cost. And if they don't think it's relevant, they're not going to spend their time on it. So I think we have to find a way to get to the root of belief systems and more creative or unique ways to help people understand. For me, I think it's people don't understand vehicle heating dynamics. We have to shift away from the personal, you know, what people think, you know, the belief system that's out there. There's so much focus on forgetting children, and that's only one of the three primary circumstances. And so I do think from a public health standpoint, we have more work to do just from a behavior change and a health belief model perspective.
Thanks, Amy. That's very helpful. Jan, did you have something you wanted to add?
If I could just add briefly on to what Amy said. You know, it needs to be this multi-layered approach of education and awareness, increasing use of technology, trying to get some legislation, trying to get some mandates for, like I mentioned about in Texas, and getting all the information, data we've talked about today, and other information to advocacy groups so that can get out to parents, and they can, as Amy said, so that they can be aware that yes, it could happen to them.
Great. Thank you both so much for your presentations today, and to our audience for submitting all of these good questions. I hope that you saw in the chat that we included links to many of the resources that Amy shared, and you are welcome to reach out to her to partner on any additional outreach. Please also visit noheatstroke.org to check out Jan's work. Fantastic presentations from both of you. Thank you so much. And I'd like to invite our audience to please register for our next webinar. It will be Wednesday, May 5th at 2 o'clock, the Child Safety Learning Collaborative. Together, we are stronger. Great. Thank you all for joining us today. And if you would please take a moment to fill out the survey and let us know about your experiences with today's webinar. Have a great day, everybody. Thanks again, Jan and Amy.
Thank you.
Thank you. It was a pleasure.